because you've been referred to me for some pretty severe and chronic headaches, and also some significant jaw pain as well. I'm so glad that you came in. I know that living with that kind of constant tension is just incredibly draining. But you are in the right place. My goal today is simply to help you find some real, lasting relief. We'll take our time, make sure that you are completely comfortable, and figure out the best path forward for you. So let's start by just chatting a little bit about what you've been going through. I'm just going to pull up your file here, and I'll be making a few notes as we talk, just to make sure that I'm getting everything right. Alright, so the referral mentions persistent headaches and jaw pain. Can you tell me a little bit more about that? Like, where does it hurt the most? I see. So, a deep aching pain right in the jaw muscle. It feels like it's on both sides. And the headaches, are they all over, or do they seem to pop up in specific spots? Okay. So, mainly in the temples, sometimes wrapping around your forehead. Yeah, that's a very, very typical sensation with this kind of tension. If you had to use a pain scale, say from 1 to 10, where 10 is the worst you can imagine, what's your average day like? A 6 or 7, yeah. And what about on a bad day? A 9. Okay, so that is way too much pain to be living with on a daily basis. It's no wonder you feel so worn out by it all. I want to assure you that what you're feeling is very real, and we have some really effective ways to manage it. Okay. Do you notice the pain is worse at any particular time? Like maybe the first thing in the morning when you wake up? Yeah, it is. is what leads to that deep, nagging ache. Okay. Have you tried anything to fix it so far, like painkillers, a mouth guard from your dentist, anything like that? Got it. So the mouth guard protected your teeth, which is good, but it didn't do much for the muscle pain itself. And the pain relievers are just a temporary fix. That is a story I hear all the time, and it's exactly why we look at a treatment that can address the muscles directly. Okay. Alright, thank you. That gives me a very clear picture based on everything you're describing, the location of the pain, how it's worse in the morning, the connection to stress, and the fact that it's causing headaches in your temples. It points very clearly to temporomandibular joint dysfunction, or TMJ. It's all caused by overactive muscles. You have these two big, strong muscles on each side of your face. When you clench, these muscles are stuck in a state of constant contraction. Imagine making a fist and never letting it go. Yeah, that's what your jaw is doing. This creates pain in the muscle, and also it just radiates out, causing those awful headaches. It's a vicious cycle of tension and pain. But the good news, the really good news, is that we can break that cycle. The treatment we're going to talk about is designed to do exactly that. It gently tells all of those overworked muscles that it's okay to muscles myself and confirm what we're dealing with. Is that alright with you? Okay, perfect. I'm just going to pop on some gloves. They make a little crinkly sound, which a lot of people actually find quite relaxing. There we are. Now I'm just going to have you lean back and relax. I'll start by gently palpating the muscles, just applying a bit of pressure. So let me know if you feel any specific tender spots. Okay, I'm going to start here on the right side of your jaw. I'm just using my fingertips to feel the muscle itself. And wow, yeah, I can feel it immediately. It's a classic sign of an overactive muscle. Does it feel tender when I press right here? It does. Yeah, I felt you flinch just a little tiny bit. I'm sorry. I'll be very gentle. Okay. Okay. Now could you do something for me? Just clench your jaw for a second. Okay, and relax. Yep, when you clench, I can feel that muscle just pop right out. It's incredibly strong. Definitely working overtime. Okay, so now let's check the other side. I'm just going to do the same thing here. Gently feeling that muscle, and it's the exact same story on this side. It's a lot of tension. Let's have you clench one more time for me. Okay, good, and relax. So it's really important that we treat both sides equally to maintain a nice balance in your jaw. Even if one side feels a little sorer than the other. Okay, now I'm going to move up to your temples. Okay, I'm just going to place my fingers right here. Can you feel that? The tension here can be more subtle, but it's a huge player in tension headaches. I'm just gently pressing. Is there any tenderness? A little bit. Okay. And now can you clench your jaw one last time for me? Okay. Yeah, there it is. I can feel this muscle. It's engaged all the way up in here whenever you clench down. such an effective treatment for this. The Botox will work to gently relax these specific muscles that are causing all of this tension and pain. Okay, I'm going to just get my little light here. It's nothing too bright. I'm just going to shine it on the sides of your face. It helps me visualize the contours of the muscles a bit more. You can just look straight ahead for me. I'm looking at the left side. Yeah, this light creates a little shadow that shows me the thickest part of the jaw muscle. Perfect. And now the right side, sorry. The right side. Same thing, excellent. And up to the temples. Very good. This just helps me make sure that the placement is absolutely perfect. Okay. So you are a perfect candidate for this. I'm very confident we can get your pain levels down and make a real difference in how often you get these headaches. So, are you feeling ready to go ahead with the treatment today? There's no pressure at all, but I do think that it will bring you the relief you've been searching for. Wonderful, I'm so glad. Your comfort is my number one priority. So if you need a break at any point, you just let me know, okay? We'll go as slow as you need. So first things first, we need to prep the area. I have some antiseptic wipes here. They're going to feel a little bit cold on your skin. I'm just going to gently wipe down the sites to make sure that everything is perfectly clean and sanitized. Okay. Okay, so just relax your face for me. We're going to start on your right jawline. Just a gentle, cool wipe across the skin. Very good. Now the left side. Cleaning this whole area. Perfect. And now up to your right temple. And your left temple. You might notice some tiny little bumps at the injection sites afterwards, like little mosquito bites. And that's totally normal. They usually fade within about 20 minutes. Okay. Next, I'm going to mark the injection points with a very soft surgical pen. just making a couple of marks on your right jaw. Can you clench your jaw for me again? I just want to make sure I get the correct spot. Okay, perfect. That lets me feel the exact border of the muscle. Okay, I'm just making a few little dots. Tiny dot here and here. One more dot right there. Okay. You can relax your jaw. I'm going to mark on the left side. So can you go ahead and clench again for me? Excellent. I feel it right there. And we're just making a few more little dots here and here. And one right there. Perfect. You can relax your jaw. Okay, and now we just have to make a couple of marks up here in the temples on both sides. So just right here and on the other side, right there and here. Alright, so the mapping is done. We're ready for the treatment itself. I have the Botox right here. For TMJ, we use a bit more than in cosmetic treatments because these jaw muscles are just so large and strong. We'll use about 20 to 25 units in each of the jaw muscles, plus a few more in the temples. It's a very safe and well-established dose for this kind of medical use. You have nothing to worry about. And the needle I'm using is incredibly fine, one of the smallest ones made. Most people say it feels just like a tiny little pinch, and it's over in just a second. And I'll talk you through every single one. We'll do this together. Okay? And if at any point you need a break, please let me know. So just take a nice, slow, deep breath in and let it all out. muscles, it's time for a long overdue break. Now we just have these few small points in your temples to help with the headaches. These are even quicker, okay? Starting on your right temple. Okay. Just a very quick poke. Okay, ready? 1, 2, pinch. Okay, great. How are we doing? Good. Okay, we'll do the other point on the right side. 3, 2, 1, pinch. Okay, wonderful. And now finally, the left temple. Just 2 more tiny pokes and we are all done. The first one, 1, 2, 3, pinch. Okay, and the very last one, right? 1, 2, 3, pinch. Great. You have been so amazing. Are you doing okay? Okay, good, good. Alright, well, we are all done. You did it. The entire procedure is complete. You did absolutely wonderfully. I am just going to take a soft, clean cotton pad, 2 of them actually, and gently blot the areas. I'm not rubbing, just a gentle press. Get off any little bits of fluid. Just a little press here and down here. Perfect. All finished. Now I have just a few simple instructions for you to make sure that you get the best results. So first, please try to stay sitting upright for the next 4 hours or so. No lying down or bending all the way over. This just helps the Botox stay exactly where we want it. Also, try not to touch, rub, or massage the areas for the rest of the day. And no strenuous exercise for the next 24 hours. A gentle walk is fine, but nothing that gets your heart rate way up. Today is a day for relaxing, okay? So take it easy. You can, however, gently exercise your face, smiling, frowning, moving your muscles around. It's actually a good thing. It can help the Botox settle into the muscles even further. Yeah. Now, when will you feel a difference? It's not instant. You'll probably start to feel a subtle decrease in tension within about 3 to 7 days. The full amazing effect will build over the next 2 weeks. That's question.